So thank you. My name is Robert Smith, and just wanted to give you a little different perspective on hearing loss today. In our prior seminars, we talked about a lot of the same things we may touch on today, but we're looking at them from a different view, and that is what are the costs associated with untreated hearing loss? And as we always do, got a little technical difficulties here. So first of all, I wanted to get the definition of consequence, and it's just a result or effect of an action or condition. And so the question I want to throw out there, and I hope I get you to think as well, we see these things every day in our practice, but how much does untreated hearing loss cost? And so the first thing we think of is a dollar sign, because typically when something costs us our hard-earned dollars, especially if we're retired and we only have so many, we think twice, if you will. So I just want to take you down a little path, and this is not something that I think, but it's what our patients teach us every day, actually for the last 34 years. And I consider them the real experts, and they're my real professors and teachers. And so we try to listen to you out there. So we take a 70-year-old beautiful woman here, and we just throw a little statistics out that hearing loss is common, and as we chronologically enhance, it becomes more and more common. We have a higher incidence rate. It says here from Journal of American Medical Association that people that are over 71 years old or older have a 65% incidence rate of hearing loss. Obviously, by the time we hit 90 years old, God willing, 96% of us are going to have a hearing loss. So stick around long enough, we're going to have a hearing loss. I'm not sure that's good news, but it is real. So the thing of it is fewer than, and actually I'll challenge a stat here. It says fewer than 1 in 3, 33% have actually done something about their hearing loss and sought treatment, whether that was hearing devices or cochlear implants or medical intervention. So a very small amount of people have taken a stab and taken care of a very large, widespread bodily function challenge. So what's our first response when our body starts to malfunction or not function correctly? A lot of us, me included, we stick our heads in the sand and we just hope and hope and hope that it's going to go away. And I want to share a quick personal story. My bride, Pam, of 32 years, recently or last year, she was actually diagnosed with inflammatory breast cancer. And it was really aggressive. It came on really fast. It showed really quickly, and it seemed to be spreading rather quickly. And so that's one of those things we couldn't stick our head in the sand about. It was visually, it was visible, so much so that we sought treatment and tried to get in the front of the line, and we did. We got ahead of it. Things are going really well, by the way. Appreciate your prayers. But had we stuck our heads in the sand and just let's see what happens and let's ignore it, then she actually, in this short time, she probably wouldn't be alive today. And so many times I think that with hearing loss, we minimize it. It's not cancer. It's not heart disease. It's not a heart attack. So we think because it's not going to cut my life short today, I'll just ignore it. And there are consequences to untreated hearing loss. And I saw these slides, and I think back about the things that we see every day, the heartache and the pain that hearing loss, especially when we ignore it, causes. And one of the things, we've got a scene here with a mom and a daughter, and maybe this is your situation, whether you're the person with a hearing loss, or maybe whether you're the family member, and you just want the best for your family member that you love dearly. And so many times there's a contentious moment where you're not in agreement. And maybe it may seem that the person with the hearing loss isn't open to getting treatment, getting help, actually. And here, maybe you're having, maybe you're aware that hearing loss can cause falls. our good friend Frank Lynn from a great university in our country, Johns Hopkins, he's keenly aware and has helped us become aware that even for mild hearing loss, our risk of falling are much greater than a person who has normal hearing. So that's one area. And think about it, as we stick our head in the sand and as we avoid these conversations of dealing with our body, dealing specifically with hearing loss, things typically don't get better in relationships. And we know, and we try to convince the people that we love when we study hearing loss that it can cause cognitive effect because our hearing supports our cognitive. We actually hear at the brain. So if I don't feed my brain the right food, it's not going to be healthy. My ability to communicate to the people that I love and just other people that matter in my life is going to decrease. And so while we know our avoiding getting help for our hearing does make a difference to our cognitive function, it does give us a greater chance of developing dementia over the years. We still may not be ready to deal with this. And so what happens in our relationships? They become strained. And here, our friend from Johns Hopkins, Franklin, tells us again that it can make the brain work harder when we ignore a hearing loss. The brain's got a strain and it forces it to try to fill in the gaps of the words that we don't understand, even if it's a little word here or there in the beginning. And then over time, it just develops into be losing maybe a whole sentence and then maybe the subject matter. And so what happens to our relationships? The real cost of a hearing loss is far more in relationship cost than the dollars and cents that it may cost us to seek the help and treatment that we need. So as we become less socially engaged, we watch our patients out, especially we do a lot of work in retirement community, independent as well as assisted living, and we see people go through seasons of life when their communication breaks down, especially with their family and those that matter around them. They tend to isolate. And we know, obviously, from isolating inside our own rooms, if you will, inside ourselves, we are much more likely to develop depression. And then we literally do not want to confront the world because it's going to highlight or magnify our malady, and that may cause embarrassment. And so we got a breakdown in communication going on here in the scene with a mother and daughter, both who love each other, obviously. And here's the thing is, it all starts with an honest conversation. We just got to take a look in the mirror and say, what's happening here? And what am I doing about it? Is that making the situation better or is it making it worse? And what I find fascinating is that mothers and daughters, family members who love each other will often, there's no easy way to put this. Sometimes we're mean to each other. I'm guilty of it in my own family, whether it's my bride or my mother, my sisters. And so many times we're so honest, if you will, we can be honest to the point of being mean and breaking off our conversation and holding grudges. And all the while, this hearing loss may come between us and drive us apart, and it divides us. And so how beautiful it is when we turn to each other and we have this conversation and we realize this is really costing us. My relationships are strained when I avoid taking care of my hearing. My ability to socialize and interact with other people and going to providers who are trying to help me, especially in the senior stages of life. As one man tells me, his social life is about meeting new doctors. And while that's funny, it's so real. And as I chronologically enhance, I'm beginning to relate more and more. But it all starts with honest conversation. And when I'm willing to be vulnerable and admit that maybe I'm not 100% in all these areas, then I can allow those people who love me in, and they can also walk by my side to find the right help, the right providers, the right team that can help me take care of this hearing loss. So I really want to invite you again to pause right here and ask yourself, if you're out there and you have a hearing loss, and I'd ask you, what are you doing about it? Is it okay to let it go? Is it okay to bury your head in the sand? Or maybe you're someone out there who has tried. You've gone to a provider, you've sought help. Maybe you've tried hearing devices and they've just failed you. And maybe you just want to quit, and you say, it doesn't work for me. I tried and it doesn't work. And I'll just live with it. It's not that bad. I can live without it. And all those things may be true, but how are you doing in that relationship department? What is this hearing loss truly costing you? And even if you don't think about yourself, what's it costing your family? Is it costing a son or a daughter a relationship with you? Or maybe you're struggling over the phone when they call, they live out of state. And I'd switch gears. If you're a son or a daughter or a niece or a nephew, a caregiver, a power of attorney, what's going on with that person that you love, that you're caring for? Is so many times I hear someone say, I really don't think they mean this, but I hear family members say, it's okay, she's getting older and that's just part of life, right? And and what I want you to stop, if you wouldn't think about, is I want you to see your mom or your dad or your aunt or your uncle. I want you to watch their facial expressions. And I want you to watch the strain on their face as they try to dial in to what you or someone else in the room is saying, especially if it's a lecture or a church, or the pastor in the front, or a group where there's a lot of people around, or a family member. Watch their facial expressions. And so many times you'll see this real strained look. Their whole body goes into flex mode. And and then I would invite you, even if you've never seen it before, I would invite you to play a video in your head. What would mom or dad look like if they could connect again? Would their face look differently? What's going on inside their heart? Would their heart smile more often? Would it be easier to have a conversation with them? Would I be less frustrated? And you may say, well, mom or dad's tried that already, or it didn't work, or those things. So many people talk about hearing devices. Those things, they don't work and they cost a lot of money. And so many times we help our loved one throw in the towel of life. And there's a real cost there, because if you study the stats, if you study Johns Hopkins and University of Colorado, you'll find that cognitive decline happens faster among a person who lets their hearing loss go. And so that smile, that bright light inside the heart, can go dim faster. So what if we take a proactive approach? And what if we actually get our head out of the sand and don't give up? If you're out there, it's worth it, whatever it is. Yeah. Now, listen, selfishly, I wish you would call our practice. We'd love to take care of you and be part of your transformation. But whoever you call, wherever you're at, whoever you trust, the payoff is joy in relationships. And I repeat myself from webinars past that COVID taught us that we really need each other. This thing called communication, connection with each other, it's as vital as oxygen, I believe. And I notice that people that are in community that relate to each other are much happier. There's much more joy in their life, a smile on their face, and even yet, better yet, a smile inside their heart that you just can't mask or hide. And so my encouragement to you all out there is pick up the phone, get the process started, wherever it is, whoever it is. If you find that wherever you call first, wherever you visit first doesn't work, please push that provider aside and find one who's going to help you get back into that life that you want to enjoy. And I'm going to take questions in a minute here, but I just want you to stop and think about the real cost of letting go, of giving up, of ignoring. In so many parts of our body, we think, I can't ignore this. Hearing loss seems to be one of those that most of us wait 10 years statistically before we actually take action. And those 10 years, I want you to know that skill dampens, skill drops off. The longer you wait, the harder it is to help, the less you get back, and the less communication and clarity in the brain you're going to have. With that, I just want to encourage you to take that first step. So before we get to questions, I just want to remind you there's an email below here. And one of the nicest people, one of the most caring people you're ever going to talk to in your life was named Hazel H. Osborne at sjhi.net. If you email her or you call 877, this sounds like a commercial now, call 877-226-1186, 877-226-1186. What you're going to find on the other end of that phone call is someone, an 18-year veteran with our practice. She knows how to coordinate care for you, knows how to get you in front of the right provider for the right thing. She'll be happy to answer questions for you that you may have or fears that you want to address. And I can't tell you how important it is to make that first action to get up off of the couch. And now we're going to turn this over to you so that you can ask questions. So go right ahead. And those of you who are going to tune out, by the way, I just want to thank you for coming. And this will be on our website so that if you would like to share the content with somebody you love, please just see our website. Probably give us about a week to get it posted. There are other webinars there that are probably worthy of a listen. And so we just want to thank you for coming and thank you for taking care of yourself. If you're a family member, just want to say thank you for following through for that family member, for maybe helping them when they can't. So you all can go ahead and we'll take questions now. And by the way, we will stop the recording, Tim.